I am Dr. Mary Taheri, and I'm running for California State Assembly District 69. I've been working as a healthcare provider, as a nurse and a nurse practitioner for decades with the underserved, veterans, homeless, undocumented, uninsured. And I've been boots on the grounds for decades with these individuals. I know what the system needs and where the failures are. And so I thought this would be a perfect opportunity for me to get in and make a difference. The way I look at this, so number one is homelessness. Number two is affordable housing. And number three is affordable or accessible healthcare. Not all in those three, it doesn't have to be number one, So they're all each are as important as the other. And to me, they intertwine. As a healthcare professional or nurse practitioner, I see that I'll give you an example. In the emergency room when I was at Harbor UCLA, I had a couple that came in who had worked most of their lives and built their dream home, their business. The husband was diagnosed with a terminal with cancer, which means he's going to pass away. And they had private health insurance, but they couldn't afford to pay and keep up. So they had to get rid of their home and pay towards their medical bills. They lost everything. And by the time they came to us to treat them at our county hospital, there was so much delay by the time they got to us that he was already dying. And they've lost everything, and now they're homeless. No American should have to go through that and suffer. And that's why I'm running. Homelessness crisis, we have to house first before we can treat mental health and substance use. We've tried to treat our homeless clients on the streets. It's not successful at all. That's why we're having these issues. And then the other thing is really, for me, I am a nurse practitioner. I've been doing this for decades. I had to be off work on a medical leave recently, and I lost my health insurance. Do you know that I have to pay for me and my two kids and my husband almost $1,800 a month while I'm not working for health insurance? Who can afford that on a regular, $30,000 to $50,000 a month yearly budget? So you either end up homeless or you have to, seek medical health care when you need it for emergencies or preventive care at a county facility, which is overwhelmed right now with how many patients we have. If elected, I will be the first Afghan American nurse practitioner to hold a legislation seat ever in our history. And one of the things that inspires me to run for office, my little girl is 9 years old. The other day she asked me, from school they're doing women's projects and things like that for women's history. She said, "Mommy, how come it wasn't that long ago when women couldn't vote in our own country?" And I said to her, and this is what she said. She said, "Just because I'm born with different body parts than a boy, so I wouldn't be allowed to vote?" And I said, "No, honey, things are changing, and it's important for us to continue. Yes, it was like that, but no more." A little bit about my background. My entire family was assassinated by the communist regime, the Soviet Union, former Soviet Union, which is Russia now. I was born in New York. I did move to Afghanistan when I was 2 with my parents, my father was a surgeon, my mother was a nurse. And 4 years later, the Russians invaded and assassinated my entire family. And then we moved out here, smuggled out of the country. My brother and I were the only survivors. My 4-year-old sister was also assassinated along with my mom and dad. And so I understand how it's like to grow up on welfare and to have Medi-Cal and government assistance. And I made a promise a long time as a child to myself that when I'm older and I am capable of working and supporting myself and my grandparents, I am going to make sure that I give back to our communities and our people and our country what was given to me. And so I do believe in the government assistance when you need it in times like that, when you have obstacles. It's important for us to do that so that we can, one day, like myself, as an orphan now, get my doctorate degree and give back to society.